launch of Docbrella. Before we head any further, let's acknowledge the presence of our Honorable Minister of Health and Family Welfare. A big honor to have him amongst us today. Ladies and gentlemen, please put your hands together to head a very warm welcome to Shri Dinesh Gundu Rao. Thank you so much for gracing this occasion with your presence, sir. We're also waiting for another dignitary of ours. We have Mr. Pranav Mohanty, who is going to be joining us. But I would also like to keep all of you informed that our Honorable Minister of Electronics, Information Technology and Biotechnology, Shri Priyank M. Kharge, was scheduled to join us, but unfortunately due to the flood situation in his constituency that required his immediate attention, he could not be here. But he has sent his very warm wishes, so let us give a big hand. Thank you so much for being a great support to us. On that note, ladies and gentlemen, it's now time to start off with this wonderful day. On behalf of the entire Docbrella family, we extend a very warm welcome to our Honorable Minister, dignitaries, members of media, distinguished leaders, and all our guests here for today. Audience, we are here for the launch of Docbrella, a brand new vision that promises to redefine healthcare, discovery, decision-making, and most importantly, bringing in transparency with the next-gen technology.
I'll start with a line from Gurudev Tagore. It says that, let your body be strong, your mind alert, your heart compassionate, therein lies true wealth. Today, as we are unveiling Docbrella, we all can relate with these words. Simply because the way we see and experience healthcare, that is going to be changed after Docbrella is getting launched. It is going to amend the future of healthcare in India. On behalf of Docbrella team, I would like to welcome each and every one of you present here. And a special thanks for our dignitaries, Shri Dinesh Gundu Rao, Honorable Minister of Health and Family Welfare, Government of Karnataka, Dr. Pranav Mohanty, Director General of Police, Government of Karnataka, our mentor, Subrit Parida for putting everything together for this particular launch. Today, as we unveil Docbrella, we are just not only launching a brand. We are launching a vision for a healthcare ecosystem where transparency, trust, and technology comes together. At Docbrella, our vision is to remove uncertainty from the healthcare ecosystem. For patients, for providers, for everyone. Today, patients and family members are struggling with unclear cost, scattered medical records, and not being able to take the right decision at the right time because of a lot of misinformation, over-information, and a lot of other issues. On the other side, what we see that the service providers, the healthcare service providers, be it hospital, path labs, ambulance service, they are also often facing a lot of challenges in terms of connecting with the right patient at the right time, showcasing their true talent or true strength, and overall building that trust.
सस्ती, भरोसेमंद, पारदर्शी और हर किसी तक पहुंचने वाली स्वास्थ्य सेवा का आंदोलन। इस ऐतिहासिक पल का हिस्सा बनने के लिए आप सबको दिल से धन्यवाद।
Not just a platform, it is a dynamic, intelligent ecosystem which evolve with the time according to the healthcare needs of the every Indian family. So basically, Docbrella's roadmap is based on three powerful pillars. One is agentic and vernacular conversational AI. Second is the seamless integration of services, and third is the preventive care first, which we prioritize here. So our AI is built not only to understand healthcare needs, it is built to understand you and every individual. Docbrella uses advanced technologies basically to understand multi-language. It is like it uses part assistance and also regional language support to guide individual families to take a personalized health decision. And wherever you are, and also whatever language you speak, whether it's English, Hindi, and any local dialect, Docbrella will listen to it, understand it, and respond to it accordingly, just like a trusted companion. Second, majorly, whatever you say, whether it's a price comparison for your service, healthcare services, whether it's ambulance service, whether it's nurse service, whether it's diagnostics, whatever you pick from the healthcare need, Docbrella brings all together in a single platform. As if like it covers all the specific segment needs under one umbrella, like acts as a unified experience. It gives unified experience to all the people. Third is our AI-powered MediLocker doesn't just save your medical records. It over a period of time, it learns from it and it predicts risks and also proactively suggests whatever actions are needed in future quickly, just like a trusted companion.
People, when it comes to their healthcare. Healthcare is and we have our very eminent and well-decorated police officer, our DGIG for internal security, internal security, Mr. Pranab Mohanty, and all the other people who are behind part of this Docbrella venture. We just heard from them on what is the concept and what is the idea behind this Docbrella. I think it's a combination of two words. Doc means something connected to health, doctors, and Brella is umbrella. So it's an umbrella under which all the healthcare information, services, consultation, and data, all that can be put into one system and one what they just showed, the MediLocker. So healthcare is today, there is so much of information available and so many facilities, hospitals, all kinds of hospitals are there, all kinds of treatments are there. And for somebody who is not well, sometimes it can become very confusing what decision to take. And also at the same time, there is sometimes due to wrong information or not lack of information, wrong decisions can be made, or they can even be exploited also, because sometimes people go to some hospitals and when they don't know anything, they can be put through unnecessary procedures and unnecessary treatments also. So this is a very, it's part of the issue that we are facing, especially because the cost of expenditure has gone so high, and people end up spending a lot of money. And if it is done for the right purpose, then there is no problem. But sometimes when they are misguided, then that becomes a huge problem. And many of people really end up suffering. One is wrong or poor diagnosis. The other thing is wrong or unnecessary procedures. Or sometimes when they are just put through unnecessary, for the sake of commercialization of today, because hospital and medical care has become so commercial also, that they get exploited so that the hospitals can generate more revenue. So these are all the various issues, challenges. And for a person, I think for Docbrella to really become a landmark, application, software application, and an app that can be used by everybody, is how they can connect all these things. It's not going to be very easy, because you have to earn the trust of people, because healthcare is something where people are it's very personal. So they want to, be able to earn their trust also is quite a challenge. And how the system is going to work.
Launching this platform. First of all, esteemed chief guest of the occasion, Dr. Gundu Rao, who I consider, or rather all of us in the bureaucracy consider to be a man of great wisdom, astuteness, and political vision combined. He is indeed the right person to be leading the health department, and should I say the health ecosystem. And there are a lot of expectations riding on his particular point of view. And my greetings also to Mr. Agarwal and Mr. Biswas, Swetaji, Subrat, all the distinguished participants. So this has been, as I understand, an unlimited endeavor to get together on a single raft medical services and thereby end the suffering of the people that we have in terms of looking for doctors and all that. So I understand that this is built around an AI platform that helps decision making. Must be a balanced tree of some sort behind it, one of the types of AI that we have. And surely this is going to shorten the quest of people who are needing informed plan, much needed venture. Glad to hear of it. Of course, my other work other than internal security that I look after in the state is also in the DGP Cyber Command, wherein I look after the cyber security of different establishments and ICT infrastructure. As I was discussing with the Honorable Minister, just before this, one of the most critical sectors where ICT is especially vulnerable is the health sector. This is not just in our country, this is to all countries, especially in the US. There have been a number of attacks. You know that the healthcare databases, they contain data regarding the health of the patients, their vulnerabilities, what kind of tests they have undergone, what kind of treatments they have undergone. This naturally expresses itself as an invitation to attack. If a person, say, knows some XYZ whose records have been accessed, medical records, what kind of illnesses that person is predisposed to, what is the genetic constitution, what treatments has he taken, this information can be then sold to insurance companies in the background, which can then fashion a customized insurance around him without him telling him. That apart, the other aspect of health which is vulnerable to cyber attacks are the health devices, the pacemakers, you have automatic insulin injectors, and you have got many other wearable devices that they will tell that continuously go on feeding you about your health status. Many of us have that. So these are accessed by some attacker. Then that person has the access to entire your health information on a day-to-day basis.